Good afternoon and welcome to today's webinar, Navigating Common Interventions for Autism Spectrum Disorder, brought to you by the University of Iowa Division of Child and Community Health, Child Health Specialty Clinics, and the Regional Autism Assistance Program. My name is Shawn Wittrock and I will be moderating today's session. The session will be recorded and the link to that recording will be provided in an email following the webinar. You are free to type your questions into the Q&A box throughout the presentation, and those will be answered at the end of the presentation. CE credits will be available for those attending this live session, and directions for obtaining those credits will be shared at the conclusion of today's presentation. So I am pleased to introduce and welcome our presenter today, Leslie Rogers. Leslie Rogers has a variety of experience working with children on the autism spectrum, as well as in the field of speech-language pathology. She graduated from the University of Nebraska-Lincoln with her Bachelor of Science in Education in 2000 and her Master of Science in Speech-Language Pathology in 2002. After graduating, she worked for Omaha Public Schools from 2002 to 2007 as a speech-language pathologist. Leslie then moved to Des Moines, Iowa, where she started work at Childserve, a nonprofit specialty healthcare organization focusing on pediatric rehabilitation. Leslie is the director for the Childserve Autism Program, which focuses on serving children with autism up to 21 years old. In 2019, she became a board member for the Autism Society of Iowa. Leslie is an integral part of Childserve's diagnostic clinic, the Project Impact Parent Education Program, and social groups for children with ASD. She also supervises team leads for speech-language pathology and occupational therapy for the Autism Therapy Program. She is instrumental in staff education throughout Childserve on various ASD topics. Leslie has dedicated her career to combining clinical expertise with compassionate care for kids with autism spectrum disorder and their family. Without further delay, I will turn the presentation over to Leslie.
Well, good afternoon, everyone. Thanks for having me, Shawn, and I appreciate this opportunity. Through the years, I've had a lot of team members that have presented for this webinar series, and so happy to join and present today as well. This topic is near and dear to my heart as I've gotten the experience at Childserve to work in a lot of different areas across a lot of different services. And really, throughout my 20+ year career, have tried to hone in on how to make all those work together, navigate those similarities and differences to provide the best care we can for children and young adults on the autism spectrum. So hopefully something today will be helpful to you. I will be able to answer questions at the end as well, and hopefully can at least provide some support in that way, or search out some answers if I don't know that myself. So our topic today, just different interventions for autism spectrum disorder, and I have a few learning objectives we'll go over first. So the first part of the presentation will focus on the range of interventions that are available for individuals with autism spectrum disorder, including behavioral and therapeutic approaches. And I will put the disclaimer out there that I have more experience on the rehab portion of therapy services. However, do work with ABA and our behavioral health as well. You will see reflected in this presentation a lot of Childserve specific services, but a lot of specific services that a lot of different organizations and entities have. So some of them may be specific to programming we have here, but also many organizations have similar services available. The next thing I'd like to discuss is identifying principles and strategies underlying effective interventions. So how do we work together? How do we choose those? What sorts of ways have we seen that families have most benefited from those services? And the last is just recognizing the importance of collaboration among families, educators, therapists, and healthcare professionals. And I do have an education background. It's been many years ago. In the state of Nebraska. I have done some work with educators here. However, it's been much more limited the last part of my career. So can speak to that a little bit, but may not be the expert in that area as well. So we'll get started. So the range of interventions are vast. So there are a lot of different common interventions in different categories. So I've kind of grouped those together and then we'll break each of those down. So the different range of interventions that I'll focus on today are in the behavioral section, developmental, educational, social relational, pharmacological, psychological, and just complementary and alternative interventions as well. There are some of these that I don't have as much experience and slides on as others, but did preview some of the questions with Sean that you have submitted ahead of time, and do think I can maybe provide a little bit of support with some of those questions related to those areas. So we will start with breaking those down. So I'm not going to read off this list because I'm going to go through each one individually, but you can see how confusing this might be if you're a parent or a family just getting started on your journey, or if you are trying to navigate the middle of it and figure out what's the next step. I can totally sympathize with the list here and how confusing that might be. We do have some supports in place at Childserve that help navigate that. I know family navigators as well in the state of Iowa can help navigate some next steps for what might be the next best recommendation. So as we talk through these, I can kind of elaborate a little bit on how some of those referrals or how you might find your way kind of on the path of all these different services. So we'll start with behavioral services. So ABA is probably the most well-known service out there for children or young adults on the autism spectrum. We see that we work a lot with our ABA program here at Childserve. It really is an evidence-based program, a science that uses behavioral principles and evaluated through research on learning and behavior. Something that we focus on here as well is really looking at naturalistic developmental behavioral interventions, which has been a nice mix of really inclusively looking at what naturalistic or developmental sequences we can involve in our practices for ABA as well. So tools, coordinating with speech and OT to really to develop those play-based therapies. This ABA, as many of you may know, can be implemented in clinic, school, home, and in the community. Services are typically provided one-on-one for 4 to 30 hours a week. And that varies just based on the treatment plan for the child and what the family is able to manage within their week as well. The waiting lists are very long for this. I know that was a question that I can address at the end of the session today. What can we do while we're waiting for maybe ABA services, psychological testing? So I do recognize that and definitely can comment on that towards the end of the presentation. With each of the services, I just really wanted to include a quote or a story, a short story that illustrated the success that the program had or the child and family had. So some of these, you'll see pictures throughout the presentation of a quote from a family, a picture of a child that is really illustrating what they benefited from. I think it kind of makes it more personal so you can see how the service might relate and what things they worked on. So this specific quote and pictures is Isaiah has grown so much in the last year. He's learned to communicate, play, make friends, be more independent. They saw some reduction of challenging behavior and just how ABA was so instrumental in helping this family practice the skills that he has learned here. And that's helped at home and in the community. So I like this part. It's not a cookie cutter program. They really take the time to learn about him and how he best responds. And that's really when I think of ABA, you know, they do a great job of building rapport with the client, learning about their interests and really helping them use those interests for their benefit and their play and developing those relationships. They spend a lot of time with children. And so I think they get a really valuable experience with getting to know individually the child they're working with. In behavioral health as well, this program, so ABA, really a lot of organizations, you'll see a lot of ABA clinics or ABA services at a larger organization. This program is specifically related to something at Childserve we do. It's a one-of-a-kind program in the state of Iowa. It is not totally daycare. It's not totally preschool. It's really a therapeutic day program for children ages 2 to 6 that we provide. There's program components worked into their day here, including their therapy appointments, OT-PT speech if they qualify for those. TRP goals, so therapeutic restorative program goals that are written by the therapy team for this classroom staff to implement during the child's day. And then we also utilize a curriculum that has really a lot of learning domains, academics, play, social, communication, that we use to track progress and collect outcomes, as well as just really teach kids, break down skills to teach them the things they might need in their day. There is some eligibility components to it. A child does have to be on Medicaid. They have to be within the ages of 2 to 6, and they have to have an autism diagnosis in order to qualify for this program. We do have this at all our locations across Childserve, across the state of Iowa. Here's just some outcomes that we've seen from this when measuring on our probes. So you can see the different domains that the children are working on: receptive expressive language, functional routines, spontaneous language, pre-academic skills, and play and social. And these you can see across the growth, across the amount of time that they're here from their baseline, which is in the kind of bottom bar to the left, all the way up to their 33 months, up to 36 months that they're here. So tremendous growth we've seen with this program that children are able to be in. It's been very beneficial for the child and for the family as well. So it's a great program. It's not something that's available, I recognize, across some rural areas, unless you're able to drive to those. So I do recognize that this is not a common program out there at all sites and locations. However, it is something that we do have a lot of kids in across the state in our Childserve locations. Here's some more just outcomes related to that program as well. So within the behavioral health autism service domain at Childserve, we recognize that parent education is an integral part of intervention. It probably is the most important part, actually, of intervention, is how we train parents in communication and play skills. So really that you can become that child's play partner at home and therapist, and really develop those skills. We've seen the most impact, I think, with these programs that have a component of parent education. This is something that a lot of places do across the state. I know all ABA programs have a parent training component. It may look similar to Project Impact. It may look a little bit different. This is just a specific evidence-based program, and that's why it has the name. But there are a lot of parent training that ABA therapists do as well during the week when their child is enrolled in that. So specifically here, we've chosen a program that is out of Michigan State. It's evidence-based. It teaches social and communication skills to a young child with autism. And research has shown that families who participate in this program really gain a lot of skills. And it really not only impacts the therapists if they have this training, but also when they can coach the families and caregivers with these same skills. Typically, this one is a 12-week program. There are other programs out there that are longer, shorter than that, or can be extended. This specific program is 12 weeks of classroom / learning PowerPoints and video watching for the families, but also coaching sessions every week as well with what they're learning. I have a great video. Sean and I worked really hard in this webinar presentation mode to get the sound to work and just could not quite get it to work. However, and I thought it might be a little short on time as well, these stories are on our website, www.childserve.org. And I'm also going to allow Sean to send Sean my PowerPoint so that you can watch these videos on your own if you have time. This video is about a child that's mom went through the Project Impact training and just about how how much stress it relieved from her, because she knew, had skills and knew what to do. And she just felt so much more confidence each day with playing with him and really helping him along. So it was a great story. I hope that you get to watch that as time allows. Oops, it's going to play. We'll see if I can get it to go to the end and move on. All right, so we're going to move into the developmental sequence of interventions that are available. So the first one, speech language pathology, is in our rehab type developmental scope, and is a very nice standalone service or complementary service along with some of the others we've discussed. So speech language pathology really does a lot. I think sometimes people assume they just work on articulation, but really all of these things are things that that speech language pathologists can do. So the heavy components, I think, of what we mostly do, spend a lot of time, are pragmatics or social language, as well as just general language development. We also do a lot of AAC or alternative augmentative communication, and really helping kids use their words and that way. So a lot of times, you know, if children are non-speaking, we'll get them in to start assessing kind of what device or augmentative communication, whether it's low tech or high tech, they might be able to use that type of communication. So I have a nice quote and story. So this is an AAC story. This is Jacqueline with a child, and she said that, I recently saw a child use their device to communicate my turn for the first time ever. They turned and looked at their classmate and knew right away that they had understood. What an amazing connection. Moments like that remind me just how changing AAC can be. And so I just really think that that illustrates the excitement that's out there when a child can use a device to communicate and really say something they maybe haven't been able to. So it really is exactly what the picture shows, pure joy. Another rehab type of therapy that we have is occupational therapy. They also do a variety of things, lots of different things you wouldn't necessarily anticipate, especially in the pediatric world. They do work on the things that you would think, like fine motor skills, button snaps, zippers, those sorts of things, writing, handwriting. They also work on gross motor skills, but also really work a lot on visual motor. So a lot of times we'll see children that aren't tracking when they're reading, or are struggling to really develop those visual motor skills. And so an occupational therapist is able to assess and treat that as well. Sensory processing is something that a lot of people are familiar with. We've had lots of great sensory friendly events in the community that have gone really well, as well as just a lot of times a good complementary service to mental health therapy or ABA is occupational therapy, to look at some of these things like that. It's been very, very helpful for families. And then also more traditional ADLs, activities of daily living, and independent activities of daily living. So for instance, we'll talk a little bit about group services. So as your child or young adult ages, you know, what services are available. And a lot of times it is going back and working on some of those ADLs as children progress in age. So they may get a service, even speech or social language, or occupational therapy for this when they're younger, but then as they age, their skill set needs to change. So it might shift more to work on money management or organization with school, or just being able to independently make their bed, clean their room. Those sorts of skills kind of shift as they get older. So the nice thing about autism programming is that if you can find programs or places that, you know, their skills can progress across the age, whether that's they've gotten services when they're younger and been discharged, but then go back to maybe get some services that might benefit them as they get older. So I do think this is an area that kind of is able to progress and change as the child changes. Here's a great quote. You can see the therapy dog there as well. Children with difficulty motor planning have a hard time getting a message from their brains to their bodies in order to perform an activity. So engaging children in climbing, crawling, going around, encouraging them to come up with new ways to move their body, imitation, these activities help kind of gain their basic knowledge and help them just as they grow. Physical therapy is something that there are a lot of individuals that will get this as well. You may see this service needed if you're seeing increased difficulty with just gait or walk, balance and coordination. So a bigger focus maybe on the gross motor skills than what occupational therapy would give you. If there's some home exercise programming, a lot of times physical therapists, all therapists really, but are used to writing a home exercise program for families specific to increasing that balance, coordination, and strength. And then they have a lot of specialty areas that they do. Some of these you might know what they are. Serial casting. We have, and I'll show a picture in a little bit of an exercise unit. There's a concussion clinic, aquatics, FES. There's a multitude of list of things that they specialize in. And really, your primary care doctor would help with determining what those needs are in their referral. But also families. We have a lot of families that know that aquatics is a great motivation and tool, a modality for the child to increase some of their skills and balance and coordination and all those things. So a lot of times if that's available, that can be a great alternative and motivation for children as well. So this is the Universal Exercise Unit here at Childserve. This is something that's been really great for kids for strengthening. It just gives them freedom and support to gain skills, helps with walking, makes them stronger for different activities they need. You can see this child then progressed to jumping and was more active in her sessions. And so I know the physical therapist really appreciate some of these specialized services that they can provide. Feeding therapy is another therapy in the developmental sequence here. Also, behavioral health has collaborated and worked with our therapy team to make a child successful. We've had mental health and occupational therapy work together before for a feeding client. We've had ABA and speech therapy work together for a feeding client. So I think when you can find those services that will really work together, it could be a huge benefit for the child. Here at Childserve and a lot of places that have feeding therapy, there's really a focus on breaking down whether the deficit is more oral motor or related to how the mouth moves, or if it's more of a sensory concern where the food is aversive for whatever reason, texture, taste, smell, all of those things can cause food to be aversive. We do have a clinic here where it's a interdisciplinary, multidisciplinary clinic that evaluates and writes a treatment plan for the child based on what they see from that evaluation. We do also have some feeding groups where that group setting is the best for children to really have to take in more stimuli and be able to replicate kind of that family or group setting where they're eating with multiple people. As well as some snack groups in our day program, just working on a variety of skills, attention, of course, feeding, but other things as well, just participating in a group setting. Here's a quote from one of our speech language pathologists in the program. She said, "Family meals provide the framework for conversations, which create opportunities for kids to practice telling and listening to narratives, develop sequencing skills that might have occurred during their day, ask and answer questions, and improve basic social skills like taking turns and making eye contact." So there's a lot of great reasoning for this and a good reminder. I don't think I even do the best at utilizing those times as well in my home. Group sessions. So group is something that crosses the bridge over from behavioral health into developmental as well. A lot of these groups, we coordinate between services. So it might be OT speech and mental health It might be ABA and a speech group. We really try to utilize the best setup for what the children need. So a few different types of groups. Once again, some of these are specific to something Childserve does, and a lot of them aren't. They're just in general, a lot of organizations provide these. Peers is an evidence-based group curriculum that is out of UCLA, and it utilizes a format where the teens or young adults meet with a group to work on what social language items they're learning, and then the families and or caregivers meet with a therapist to learn the same things, so that they can kind of help be a social coach or help problem solve through situations that might arise. And so this has been very helpful because it allows the families to participate in what the children are, what they're learning. So I think that's been very successful. Some other types of groups, we have just general social language groups where kids can practice, interact, have fun with their peers, talk about their interests, and get to do different activities together and kind of generalize some of those things they're learning, and incorporating them in with same age peers. We also have life skills groups, which focus more on those independent daily living skills, such as the ones I mentioned before. We have a job skills group. I know a lot of places have life skills groups where they focus on cooking, communication, job skills. We even recently opened up a small business here where kids are able to, we call it Snack Shack, and kids are able to sell prepackaged snacks, and we have an iced coffee machine, and use our cash register and everything just like they would in a real life situation. So anytime you can integrate those things they're learning into a volunteer opportunity or something else is really beneficial and motivating as well. And then the dog agility group, you see the picture here, and I think there is a picture later on that shows the dog agility group working on gross motor, fine motor, and some social language as well, with dogs being the main motivator there to kind of help and guide them through. So it's a fun group. All right, so we have, I'm wondering if let me go back real quick. I feel like I skipped over, nope, okay. So there's a picture of the dog agility group that I mentioned. I knew it was a couple forward, so the kids are having a lot of fun. All right, so educational. Once again, I will let you know that's been something that I was active in 15-ish years ago, and have had some work with school collaboration here in Iowa, but not a lot, so it's not my specialty area. But I do know that there are a lot of opportunities available in the educational realm and a lot of collaboration that we can do together. One specific instance I know we've done is AAC devices. So the speech language pathologist at the school and the speech language pathologist at the organization can work together to collect data and really make the best recommendation together for maybe what a child might need for a communication device. So that is one way that interventions can collaborate across those different settings. We've also participated in IEP meetings or 504 planning as the school team allows. I think that that's been a great time for both sides to kind of hear what the other is doing and work on those plans together. I do know we've also had schools come in as children are transitioning into kindergarten or other transitions, that they are able to come in and observe some of those sessions or in their day program before they roll over into school to kind of set up their IEP as well. And I do know most school systems or AEAs have an autism team and specialist AAC team as well that they can work with. So I do think it's an area for future growth just in our state as well. As I think through, I think there's a lot of time constraints with it, but I do think school collaborations and collaboration with different therapies is pretty important. So. Pharmacological, I just have one slide on this. Once again, not my primary area of expertise. I do know that there's a lot of referrals that happen for this. We see a lot of referrals that we make for these different things that are listed here. Our psychologists, I know, will definitely make those referrals for families when they're doing evaluations, just to make sure they're getting the medical support that they need, if they're not already. Or if they're seeing something in therapy, they might recommend families seek these types of services out to really get a whole picture of what's going on. I have a whole other presentation I do with our psychology team on just different biomedical, psychosocial, different reasons why a child you might be seeing troubling behavior. And a lot of times it can be related to some of these medical symptoms that you're seeing. So I do think it's a really important thing to consider if you're seeing behavioral challenges or concerns, is really looking at the management of these other items, that these medical components as well. So I do think that this is a really important thing to look at and really think about as you're seeking out interventions and treatments. Okay, so I'm going to move more into some interdisciplinary team work that we do here. So in a few slides, you'll see kind of how different terminology that you can look at when you're looking at how do these all work together. So there's an interdisciplinary team. You can see these are kind of the team that's on our psychology team. So we do have a diagnostic clinic that really is able to look at a lot of different things for the family all at the same time. They provide family with diagnosis, educational recommendations, referrals, other recommendations as well. I think due to psychology waitlist, however, a lot of times children are getting into other services first before this would occur. So I do think some of the things that we all know about waitlist is hampering some of this interdisciplinary work that we've been able to do, because a lot of times they're already in the services by the time they would go to get an evaluation for a diagnosis. So just something that seems to continue to obviously be a concern for everybody, is the wait list and time and providing the right treatment at the right time. Mental health therapy is in the behavioral health section, but we put it down lower in this presentation just because it seemed to flow really well with the psychology and diagnostic piece. Mental health therapy, I think all of us know a lot about this and the need for it in our community and the wait lists that are out there with this, and obviously the work they do and how valuable it is. And I just think, you know, the amount of times I've recommended and referred children on my caseload for mental health therapy is a lot. I feel like it's a great complementary service for some of the other things children are working through. So there's a lot of different types, obviously, of mental health providers that do a lot of great different things. So they do, at least here and many other places, a very comprehensive assessment, and then can offer a lot of different modalities of treatment, parent-child interaction therapy, attachment, offering parenting techniques, trauma support, communication interventions. There's a lot of different types of interventions you can see listed here: CBT, DBT, play therapy, psychodynamic therapy. And we just recently added OttPlay and TheraPlay here to help with those early play and language skills, as well as communication with families. So there's a lot of different great things that mental health therapists can provide and meet your needs based on that comprehensive assessment, and work really well. Like I've said in the past, you know, we've collaborated a lot with mental health therapy here for feeding cases, for social language, really just follow-up care, even after a child's discharged from speech, if they've acquired some skills and they really just need some care as far as implementing them, and so they may have social anxiety, so that would be a great complementary service for them as well. So I think that obviously mental health therapy does a lot, and their scope is very, very wide. Can't read I should have hidden my controls. My top is not as easy for me to see, but I think this is the medical social work portion. Not every site has this. We usually access teams. I'm trying to think of other avenues organizations provide this with, intake teams, family navigators that are across the state can help with some of these needs. Specifically here, our medical social workers partner with families to really see what needs they need. They do a crisis assessment when they do intakes to determine if there are needs that are a higher priority than others. They collaborate with our therapy teams to provide those supports. And we also refer families back to them when they're really thinking through what is the next step, what other supports am I missing, what other supports do I need. So they can also provide supports in the community, such as waiver, help and services, transportation needs, interpretation needs. Really here at Childserve, medical social work is really the core of our access to care team. And I know not everybody has that, but I would urge you to figure out, what is that? Is it a case manager? Is it a family navigator? Is it somebody that can help you kind of talk through those next steps? It really is an important piece to just coordinating care and making sure that you're in the areas that you need to be. So here's a quote. Here's Pam, who just recently retired, had been in our medical social work team and a variety of other organizations for 40 plus years. And she really helped this child. And here's a quote from the mom about what Pam meant to her. And I know when Pam retired, that was that just is a highlight for her, this story. So she said, I never expected to have a child with autism. The mom did. It's been very difficult at times. Even simple tasks got harder. For years, we couldn't leave the house because our youngest would run away. Going for a walk or out to eat as a family was impossible. The Childserve team makes me feel like even though the path is difficult, we can continue on with hope. We are now able to do things in the community, and I've seen both my sons grow in many ways with the help of their therapists. Together, we are fighting to help my children be as independent as possible in life, which is a great goal. Other services, I won't talk as long about them, that might be out there that are super beneficial are things like respite, skilled community living, group home or residential settings, and then other alternative treatments. So here's an example of our picture of the respite center, or individual respite can also be an option. It's designed to give families a break. Sometimes they offer camp and other activities for children just to enjoy their time. Here's another video. Obviously, I'm running short on time, so I'll be able to answer some questions, but also on our website, and will be in this PowerPoint when it's sent to you. And I'm going to have to fast forward through the whole thing. I'm sorry. Skilled SCL, or supported community living, is also used to build increased confidence and independence, and individuals that provide SCL services write goals and work on daily living, advocacy, participation in community, and just other skills that are important as well for transition. So it's a great service as well. And then there's residential settings that we have through, various organizations have throughout the state. And these really focus in on community involvement, continuous care, and just integrated schooling. Here's one of the young adults there. It says, outside of school, Jack really didn't have any friends or fun activities. He longed for being in the community. Now that he lives in a group home, he has great friends and able to do many fun activities that a 13-year-old should. It talks about how he's accomplished self-care, showering, dressing, and just really provided a fun time for him and more freedom to enjoy, for the family to enjoy everything. So it's a great story. And then just other effective treatment sharing. So things to consider when so now we're moving into what things should you consider when you're trying to navigate and have services work together. What are you looking for? So when I was kind of researching this to put it together, these are the themes that came up as what if you're looking for somewhere to send a child for a referral or as a family, what are the things you should be looking for? So really your questions and during assessments and you should be looking at, is it child specific? So Is it something where the individual is coming in and getting the assessment, and it's really the skills the family, the caregivers, you, the child, everybody wants to work on? So is it centered around being individualized? Is it evidence-based? I think that's important. I've mentioned that throughout this presentation. Is there some good research behind the modalities and programs that are being used? Is it team focused? So, is it a lot of individual teams that don't work together, or is it a group of teams that work together for the family and the caregivers and the child all together? So do they focus on what is their teamwork? What is their care coordination model? Is it rounding? Do they collaborate during the day? Share treatment plans? What is it that helps them be team focused? And does it work for your family? So I think, feeling the pressure of I have to do this, I need to do this, I think really you need to focus on too, is this something that's going to work for your family and your needs that you have right now? Is there long and short-term goals? So does the teaming do long-term planning, but also short-term planning as well? And then just building in for transitions and changes that occur as well, as we talked about the spectrum of life and growing and changing and those and meeting those needs as you grow, as the child grows. So here's a couple graphics I had referenced earlier that either is great. I think that it just illustrates kind of the difference when you're looking for interventions. So, multidisciplinary, when you hear that word, it really is, there's a lot of different disciplines involved, but everybody's kind of doing their own goal. They may talk a little bit, but they each kind of have their own goal. We do have a lot of multidisciplinary things here. We try our best to be interdisciplinary, but it's really hard. So I will tell you that we try our best to not have those silos or things that are nobody else knows what the other person's doing. This approach really is a group of professionals. Each reports kind of in their own service area and works independently and may report back to the group. But they are experts in their area, so that is good. You're looking for and getting expert service. Here is another graphic that's more interdisciplinary. So really you can see the continuum here of all the different types of interventions and experts working together to come up with a common goal. This is where family members are really team members and are valued with, like for instance, in Project Impact, our parent ed program, the families actually, with some direction and some tools, help choose the goals. What's important to your family? What do you want? What does the child want to be able to do as they get older? I think the young adult needs to have input in their own treatment plan. What do they want to do? What's important to them? And then team members really collect and review this data together. And this really results in an integration and being on the same page for what the interventions are accomplishing and what the goals are. This is obviously, like I said, they're communicating together. They provide their knowledge and attitudes to support the contribution of others, and it's designed to work on common goals. And I will tell you, this is not easy. We've had our struggles here with, all experts have their own opinions, and it's really hard at times to set aside and think about things from a different viewpoint. And I know we've worked really hard to try to break down those barriers and kind of, problematic areas where we might disagree and really focus back in on why are we here? What are we doing? And not make it about us, but make it about the child, make it about the young adult. And that has helped us work through some of those barriers that we see with scopes of practice overlapping, is to really remember that we are on the same team. But it does come with its challenges. So what can we do? We can teach other team members what we do. We can learn what others do, provide feedback, and also receive feedback. And then recognize that there's going to be an overlap between roles. So a speech therapist or a speech language pathologist may do some of the same things as a BCBA, and a BCBA may kind of do some similar things, that each still has their scope of practice and area and specialties that they can really utilize to help the other person and really integrate the goals to make sure that you're on the same page. It's tough, it's challenging, but it is doable, and it's a great result. What else can we do? We can acknowledge that there could be possible problems. I think calling out that right away, saying, I know we're probably going to disagree. There might be some disagreements, but let's work through it versus kind of not acknowledging that problem. You can understand their scope of practice and frameworks, understand those things. Big thing is leave baggage at the door. So a lot of us have past experiences with maybe a different service line or provider type, and really just saying, okay, I'm going to focus in on how is that different here? How can we make it different here? Complement each other, collaborate, and just really engage in some lifelong learning. The best opportunities I've had this past year have been, we had training that was where ABA, speech, OT were all involved in the same training. And we really got a glimpse into the fact that we all do a lot of the same things and have the same goals. We have different specialty areas and a different scope and vision on how we look at it, but really we are accomplishing the same thing. So I think that was very beneficial to me. And really remember that we're being an advocate for children and families, and that's what, as providers, we need to do. All right. Here I am. If you have questions, feel free to email me. I'll do my best. Once again, I'll never claim to be the expert of all things. I do my best to put this together and draw from a variety of years of experience, but can certainly maybe direct you to a specialist in the area across the state if you're looking for a specific answer. And then my bibliography.
Awesome. Thank you, Leslie.
You're welcome.
We do have time to take questions, so please type your question in the Q&A section of your control bar. I do have a couple of housekeeping items. So for attendees who would like to claim continuing education credit, the University of Iowa Carver College of Medicine has an online portal to complete the course evaluation and download the attendance certificate. So you will be receiving an email with step-by-step instructions on how to access that online portal and complete the evaluation following this webinar. I do get a lot of emails. It will be coming out this afternoon. I have to wait for the recording to convert, so it's not an immediate email, but it will be out yet this afternoon. And I will also put the link to that portal in the chat right now. So we did have one question come in, and then I can jump into the ones that were submitted during the registration, but can you share any resources that can help with the activities of daily living for children that aren't able to access your services?
Sure, that makes a lot of sense. Yeah, I'm trying to think through the ways that we've kind of tackled those things. There's a lot of great website resources, and off the top of my head, I can't think of them. It might be something that I can collect from our occupational therapy team and send that as well, Sean, with your email.
Sure.
On if there's a website that they go to the most often. I know in the past we've used the STAR curriculum, but there's a complementary curriculum called Links. It does cost though, and I'm not sure what that cost is anymore. That does break down tasks of daily living for educators, I think is who it's mostly targeted towards. So I think that would be good. Yeah, I can definitely reach out to them and see if there's a specific website that might be more helpful than me trying to think through resources off the top of my head, but great question.
Absolutely. Some of those questions that were submitted, and I think you touched on a lot of these things, but what is the process to get someone tested to see if they fall in the spectrum?
Sure, it's a great question. So there's a lot of places around the state that have, some. I think the problem is there's not enough probably, but psychology services, I think, depending on what type of insurance you have, if you have commercial insurance and or Medicaid, I think that there's some private psychologists in the area that take referrals for that. If you just have Medicaid, I know the University of Iowa, obviously Childserve, Blank Hospital, Unity Point. I think those are the ones off the top of my head. I know there's more. So, you would want to call and do intake for a psychology evaluation. Typically that involves an intake session where the family collects information on history, just like you would for any medical appointment. A testing session, so they have different tools that the psychology team uses to kind of assess that, as well as parent interview. and then a follow-up to kind of go over results and recommendations is kind of the general way that works. So I think just reaching out to an intake team, call the main number. I'm not sure at the University of Iowa exactly what that intake looks like, obviously, but most other smaller organizations, that would be the way to do that, to get connected with an intake team.
Perfect. And I would say through the University of Iowa, you can contact the Center for Disabilities and Development, and it would be a similar intake process, I believe. What is the best way to treat the behaviors that we see during speech therapy treatment sessions?
Yeah, so I can speak from experience with this. I think it depends on the child. Obviously, that's the answer you're going to mostly get, and there's a lot of reasons why a child could be showing and exhibiting kind of challenging behavior. Typically, the things we like to look at are what is the antecedent? So what are the things that are going on that might cause the trigger for that behavior happening? It could be hunger, could be sleep, could be I don't like the activities, or I don't know what's going to happen in my session, or I'm not enjoying whatever activities it is. There's a variety of reasons. Kind of what is that behavior they're exhibiting, and then what's the consequence of that? So kind of looking at that, then reaching out to your resources, whether that's a more seasoned therapist that might have some strategies, whether that's a visual schedule or a timer. There's a million different things that you can implement based on what the child likes and dislikes. A lot of times we get information from the family. So we'll do those crisis assessments before children come in and just really find out what they enjoy, what their triggers are, and kind of work with, the family to find out what works. We have the luxury here of our ABA team. If we really need additional support for behavior planning, we do that as well, or a psychology consult. But we do draft support plans or safety plans if we are seeing that a child is doing that, and it kind of walks through those steps of talking about what's the triggers, what's the antecedent, what are some training strategies? Do we need to, if the child's having a bad day, do you need to cancel the session, or do you, if you can come, what are the things that might calm them, sensory items? It's a variety of things that you can do to kind of put those things in order. And a lot of times we collaborate and do that with the family.
Great. Another question that came in, how do we navigate services for families while on wait lists for autism testing and services like ABA therapy?
Yeah, that's tough. I know a lot of psychologists are prioritizing too, just because the wait lists are so long. I mean, I can speak from my experience here. What we do here, if a child's waiting for ABA services, is they have the option to get into some other services faster. It's not the comprehensiveness that an ABA program would have. But, can they get into OT, speech, other services that might help them until they're able to get that testing and or ABA? It's not a great answer, I know, because families can wait for a really long time, and OT and speech are helpful and can do a lot, but may not be successful unless the child can also get some ABA services. We do refer and look for if there's other ABA locations that have a shorter waiting list, trying to see if they can get in sooner other places and work together that way. It's a great question, and I don't have a great answer for that. I'm sorry, other than that.
As a family support worker, what are the most beneficial supports we can offer a family besides referrals for therapy, BHIS, etc.?
Yeah, that's a great one too. Something the Autism Society of Iowa does, that comes off the top of my head, if you go to their website, they have support groups that they've formed for different ages. So high school, they have a high school group, they have a young adult group, they have I believe a family group. If not, there's some other resources listed on their website that would offer that. Autism Speaks also has an autism response team that can kind of help with some resources or ideas. They work through case by case to give you specifics on maybe some things that would help. So those are some additional resources that you could look into, community activities out there that might support a family just that way socially, and just getting connected with others in the community that might be able to provide some of those helpful tips.
I'm also going to put a plug in there for the Regional Autism Assistance Program and our Child Health Specialty Clinics Family Navigators. So especially on our RAP team, all of those family navigators have lived experience. as a parent or caregiver of a child with special health care needs, or specifically autism spectrum disorder. And so it's, sometimes just that listening ear for families is really helpful. So I would.
You're always welcome to call Childserve as well and talk to our social work team, and they are
Absolutely.
very invested in, even if we can't get into services right at this moment, what are the other resources in the community? And much like RAP, either one, is a great resource. Autism Society of Iowa, Chris responds to emails from families every day, all day. Is probably one of the best resources in the state as far as supports out there.
Yeah, absolutely. She's very responsive.
It is, yeah.
Another question that came in, or a statement, what are some rural resources and combating limited means for rural families to attend therapy services, etc.?
Yeah, I know that's very difficult as well. And, telehealth has changed us in so many ways, but it's still difficult, to find those. Like, we do offer telehealth sessions for different therapies, if that works for you, but I know it doesn't provide all the support needed. We do try to provide trainings that are monthly on different topics like guardianship, sensory 101, through Childserve. And I know there's other webinars like the Autism Basics webinar that Kelly Pelzel does, that really are accessible for anybody in the state that has, a computer and internet. So I think, unless you can drive, which is hard, the closest distance, it's very challenging, and trying to search out some of those other virtual type resources that might be out there, like Project Impact. We can do that via telehealth, and it's done via telehealth, I think, through Michigan State as well. And that is a very beneficial parent education program that is actually really beneficial via there. We have done groups in the past, not as much anymore. Most families, are driving in, and we have that, but it's challenging. And I think ABA would like to expand a lot of their services via telehealth too. I think it's just a matter of resources, of hiring and obtaining enough staff, BCBAs and RBTs and other professionals to be able to provide those supports. I think professional, in general in the state of Iowa, I think, the difficulty with recruiting BCBAs, psychologists, is really something I know that our groups, RAP group and expert panel and everything, have talked about a lot. It's very challenging.
And this is a very specific question, but how to effectively calm an autistic child before or while giving immunizations or shots?
Yeah. And I can't specifically say I've been in that situation. I was just thinking through when Sean had mentioned this, that, I think we do go, I have gone and talked to emergency rooms about their setup of their emergency room and some things that they can think about ahead of time, like not waiting for can we reduce wait time? Can we reduce the sensory distractions and not having the, people have to wait in a busy waiting area that's loud and congested? Can we think ahead and provide some fun things that they really enjoy to have on hand? Either the parents bring them from their home, so they have a comforting item on hand. We do that sometimes with transitioning in and out, where transitions are hard. So if they can bring something to transition out that's familiar from their home that they enjoy, that can make a transition easier. Snacks, drinks, all the typical things you would maybe provide a child as well. I think the anticipation, if a child's able to know what's coming, that makes it really difficult. So I don't know what the correct answer is, whether you give them lots of warning or not enough. I think that's individualized per child. Like for mine, it's better to not give them too much information ahead of time, because then they worry about it. But some kids, that's much better, because you can talk through it and walk through a social story. So that's another great option, is social stories can be written for what to expect when you go to that appointment. So if a family can work through a social story ahead of time about a script about what might happen, that might also calm, or even a visual schedule of this is what's going to happen. So
well, thank you for that information during the Q&A.
Yeah, you're welcome.
So if I did put my email in the chat box. If you have any questions regarding continuing education, please don't hesitate to reach out. And it doesn't look like we have any additional questions coming in, so this will conclude our presentation for the afternoon. And I want to sincerely thank you, Leslie, for presenting and for all of you who attended. So have a wonderful afternoon.
Thanks so much.